Ace here. Quick question before we start. If you were struggling with anxiety, would you book an appointment with a psychologist or a psychiatrist? If you hesitated, you're not alone. Most people use these two words like they're interchangeable. They're not. And by the end of this video, you'll never mix them up again. Let's ace this one together. Here's the shortcut. Psychology studies the mind and behavior. Psychiatry treats mental illness as medicine. One is a science of behavior. The other is a branch of medicine. That single distinction explains almost every other difference we're about to cover. Here's the shortcut. Psychology studies the mind and behavior. Psychiatry treats mental illness as medicine. One is a science of behavior. The other is a branch of medicine. That single distinction explains almost every other difference we're about to cover. To become a psychologist, you go through graduate or doctoral training focused on research, assessment, and therapy techniques. To become a psychiatrist, you go to medical school first, same as a cardiologist or surgeon, then specialize in psychiatric training afterward. So a psychiatrist is a medical doctor. A psychologist isn't. That's not a hierarchy. It's just a completely different training path. A psychologist focuses on your thoughts, emotions, behavior, and relationships. Basically, the patterns of how you think and act. A psychiatrist focuses on mental illness itself, the biological, medical, psychological, and social causes behind conditions like depression, bipolar disorder, or schizophrenia. This is the question everyone actually wants answered. Psychiatrists can prescribe medication because they're medical doctors. Psychologists usually cannot, unless local law and extra qualifications say otherwise. That's the single biggest practical difference between the two.
Psychologists lean on psychotherapy, things like cognitive behavioral therapy, behavioral techniques, and psychological testing. Psychiatrists can also do therapy, but they're specifically trained to manage medication alongside medical assessment. Different toolkits. Same goal. Say someone is dealing with depression. Here's what that might look like in practice. A psychologist helps them explore negative thought patterns and build coping strategies through therapy. A psychiatrist assesses the condition medically and decides whether medication makes sense. Often it's both therapy and medication working together. If you want to talk through emotions, change thought patterns, or work on relationships, start with a psychologist. If symptoms are severe, medical or medication might help. A psychiatrist is the right call. And honestly, a lot of people benefit from seeing both. Psychology equals behavior therapy, no prescriptions usually. Psychiatry equals medical degree, diagnosis, medication. Both equals mental health care, just different lanes. That's the whole video in 3 lines. Save this if you need it later. That's the difference, cleared up in under 10 minutes. If this helped you ace your next psych exam, or just understand your own mental health options better, drop a comment and let me know what topic to break down next. And if you're not subscribed yet, hit that button. New psychology breakdowns every week, right here on ACE Psychology. See you in the next one.